So hi everyone, thank you for joining us today. This is the second day of our first virtual resource fair. So welcome and thank you for being here. So my name is Marilyn Udine and I'm with the Community Engagement Department. We also have Kayla Connors here. She'll be managing the slide presentation for all the presenters. And then we have Allie Belding, who will be responding to you in the chat. And then Andrea Morales will also be here as backup and helping us out today. So we have a big team of people behind the scenes helping us out. So presenters, thank you all very much for being here. As we're going through the presentations, go ahead and keep your video off and your microphones muted. And when it's your turn to present, go ahead and turn those back on. And then Kayla will guide you through the slides. So you can just let her know when you'd like to move on to the next slide. And attendees, for those of you that are attending, your mics and your cameras will be off. Please feel free to drop any questions that you have throughout the presentation into the chat, and we will go ahead and answer those at the end of each session. So for this session here, we have health and wellness, and we have MGA Home Care presenting. We have Pasco, we have Reset Fitness, we have Shield Healthcare, and we have Team Select. So we'll go ahead and get started with MGA Home Care. We have, I believe, Shelton and Johnny presenting. So if both of you are able to get your cameras going there.
Can you hear me?
I can hear you. Great.
Right.
Hi, welcome.
Awesome. Thanks, guys. Yeah, we'll just get to it. This is our first virtual event, so hopefully I don't mess anything up. We'll just get into it slide by slide. In-home supportive services is one of our lines of businesses from our sister company called Circle of Care. It is just another source of, kind of an income for families and resource for them to have help taking care of their children. If you want to go to the next slide, Kayla. It just kind of breaks down and talks about, everything that we do for Circle of Care. I know at the end of this, there will be time for questions. So if you have any questions, feel free to ask away. It is the primary office for that is located in Colorado Springs, but they cover all of Colorado. So if you want to just go to the next slide, I'll get into our other lines of business. This is just kind of another slide that talks about, the different types of insurances that we do, have for our lines of services. We do have contracts for all major insurances. So if you do have any questions in regards to that, we'd love to talk to you about it offline. If you want to just go to the next slide, Kayla. So I'm going to get into a few other lines of business, and then at the end of it, after I'm done, I'm going to hand it off to Shelton to talk about our therapy line of business. First line of business we have is our private duty nursing. That is essentially kiddos that qualify for in-home nurses from anywhere from G-tubes to trachs and ventilators and central lines, technology dependency essentially. We have a team of recruiters who are recruiting for day shifts, evening shifts, and overnight shifts for families, essentially transitioning from children's hospital to home, anywhere from 8 to 12-hour shifts. We provide from all ages of 0 to 21. So it's really good for a lot of families that need that help for the overnights, days, or evenings. Our next line of business is our intermittent visits. Essentially, it's just a nurse will come out for about an hour and do a G-tube teach and train or wound care or, any type of G-tube feeding or central line. So it's real quick and easy. And, how that goes is essentially a DME company will give us a call to help out a family. The next line of business that we have is basically our CNA, parent CNA program, where essentially a mom or dad go through school to get a license to take care of their son or daughter, depending on how many hours they qualify for. And it's a good resource for income, and they can have a full-time job on top of doing that for a secondary income. We run a pediatric assessment tool, which is mandated through the state of Colorado and Medicaid. and it will, break down to see how many hours a day a patient qualifies for 7 days a week. If you have any questions in regards to that, would love to talk to you about it, after we're done presenting. So I'm just gonna leave it off to Shelton to talk about therapy now.
All right. You mute it. All right, appreciate it, Johnny. So yeah, thank you guys for having us here. And I just wanted to kind of talk to you guys a little bit more about our therapy division up here in Denver. So essentially, I know you guys are all located here in the Denver metro area. We actually have a few offices here in Colorado, as what obviously the one here in Denver, but addition to Colorado Springs and Pueblo as well. So if you guys know anyone that is in need of any of the services that Johnny mentioned, or therapy services as well, feel free to pass them our way. But as far as therapy goes, we provide occupational, physical, and speech therapy services. For those of you guys that aren't familiar with home care therapy, occupational is more fine motor. So it would be grasping, help with ADLs. Occupational therapy would be help with sensory integration, sensory feeding, some behavioral concerns that parents might have with children with autism or Down syndrome, that sometimes those are accompanied with some behaviors. So that's essentially what occupational therapy is. Occupational and physical therapy are kind of the therapies that you think of when you think of therapy. Physical would be more gross motor stuff, running, jumping, balance, climbing stairs, that type of thing. Speech therapy is essentially exactly what it says. It kind of helps kiddos express themselves. Obviously, there's the expressive piece, which is telling individuals kind of how you feel. There's a receptive, which is understanding what other individuals are saying. And we also help with nonverbal completely. So that's with AAC devices. That could be with American Sign Language, anything that is kind of affecting how a child understands what's being spoken to them, or if a child has a deficit or delay in expressing anything that's of a concern or want them to them as well. So if any of you all have kind of any of those general concerns with your kiddos, feel free to give myself or Johnny a call, and we'll do everything that we can to best help you guys.
Okay, great. Thank you, Johnny and Shelton. Appreciate it. That was MGA Home Care. And our next presenter will be Pasco. So Maribel, if you're here, if you want to unmute and turn your video on.
Thank you. Can you see me and hear me?
Yes, I can see you and hear you. So go ahead and get started, and then just let Kayla know when you want to move to the next slide.
Thank you. Well, thank you to Developmental Pathways for the opportunity to share Pasco services with families in our mutual communities. My name is Maribel Sandoval. I am the bilingual community outreach person here at Pasco, and I've been with this organization for nearly 3 years. We can stay on this slide. Pasco has been providing services and support since 1992. In 2001, our founder, Barry Rosenberg, collaborated with parent advocates and Colorado lawmakers to establish a program so family members can be paid to deliver care to a loved one. Barry's work goes back to the 1970s when he was instrumental in getting people out of nursing homes. Next slide, please. Pasco serves individuals of all ages, from childhood to adulthood. Pasco provides supports that increase long-term community engagement and independence. We have knowledgeable staff with expertise in 8 out of the 10 Colorado waivers. All IDD waivers are included, CES, DD, and SLS. We have bilingual staff in Spanish to support language justice, and we will get the right resource in place to help individuals who speak any other language. Pasco provides skilled and unskilled care, and we pay for up to 2 caregivers to go to CNA school to have backup when applicable. If individuals are on the CES and SLS waiver, we also provide home health so that they get the support they need under the same agency. One of the things that we are very proud here at Pasco is to have an internal client services manager, Erica, who is helping parents one-on-one navigate the world of Medicaid to select the best option for their loved ones based on their unique circumstances. For example, when an individual is transitioning from a CES waiver to a DD or SLS waiver, we will guide them through that process. We provide services in 15 different counties, all the way from Well down to El Paso, and from Boulder and Clear Creek to Morgan and Albert, and everywhere in between. For a complete list, you can visit our website. Next slide, please. We are very proud of this comprehensive benefits package. For every caregiver who joins the Pasco family is entitled to benefits as an employee of Pasco. As long as they work and they're providing care and they work 28 hours or more per week, they get full medical, dental, and vision coverage. All caregivers accumulate sick and vacation time, and they get a $50,000 life insurance at no cost once they join the Pasco family. If you go to our website at pascohh.com and you click under events, you'll see a full list of all of our community events where we provide educational events to our families to understand the world of Medicaid. My number is, I'm going to give you my number, is 720-517-5232. Please call with any questions. You can also send us your questions on our website under the Contact Us tab, and we'll get back to you within 24 hours. And our numbers are here at the bottom right-hand corner. We'd be happy to hear from you. Thank you.
Thank you so much, Maribel. So that was Pasco. Thank you for presenting. And our next organization is Reset Fitness. So Deb, are you here?
Yes, I'm here.
Great. Go ahead and get started and just let Kayla know whenever you'd like to move forward with your slides.
Okay, we could go ahead and switch to the next slide, Kayla, if you don't mind. So what I like to start off with is that Reset Fitness is built on the belief that exercise does make a difference and that our disabilities and limitations don't define us. And so I'd like to share a little story personally about myself. I was born with scoliosis and had a hard time holding up my head, and through an innovative exercise program that my parents enrolled me, I was able to avoid future surgeries, back braces, and lived an active lifestyle. So it's my turn to give back. I'd like to do the same for others, and that's what Reset Fitness is all about. So Kayla, do you mind switching slides? Thank you. Programs are individually designed to help children and parents reach their desired goals. And the key point on this slide is that goals are different for everyone. And the best competition is when you beat your own self-expectations, and that feels really good when you get to that next level. So Kayla, I'm ready for the next slide. So I'd like to just talk a little about how results are accomplished and how programs are designed. So programs are developed based on initial conversations and assessments. And then programs are monitored and adjusted based on individual personalities and how far each child progresses. I always give positive rewards and encouragement at all events, and we celebrate all wins, no matter how large or small they are. And I try to do all this while making exercise fun, which for some people might be hard to believe, but the kids really enjoy it, and we make games out of a lot of things. And so having said that, I'd just like to take a little step back and talk about some concerns or thoughts you might have regarding physical contact and the rising numbers in COVID. So this is a very small boutique gym. Kayla, can you switch to the next slide? And it's a one-on-one relationship. So this gym is small. There's always less than 10 people in the gym at one time, and we don't share equipment. And so all of the trainers are wearing masks, and close contact with the trainers will be wearing masks in the future. This is some pictures of the gym. One of them looks like it's cut off, but you know, depending on where your child is at, an exercise program might look like this. So core is something that we work on a lot, balance as well. We also like to do fun circuiting games, and depending on how advanced your child is, you might do traditional weight training, just like the example on the top left-hand side. So Kayla, I'm ready to switch to the next slide. So you might think, like, what do parents think about the program? I think the consensus is that parents feel that their children have more confidence, which is almost as or more important than the physical gains that they get as well from working out. You can read the slide for yourself, and you know, hopefully that you'll have the same experience, and I'd love to work with your child. So that wraps up what I have to say. So I will wait for questions, I guess, at the end. Thanks, Kayla.
Thanks so much, Deb, with Reset Fitness. And we'll go on to our next presenter, which is Shield Healthcare. So we have Carlene here. Hi, Carlene.
Hi, how are you?
Doing well. How are you?
Doing good. So thank you, everyone. This is very exciting to be able to present to everybody. And I'm sure some of you might be familiar with Shield Healthcare, but we are a company that provides medical disposable supplies. We do fall under the DME category, but we don't have any DME in our actual office. It's all disposable supplies. And so that includes incontinence, ostomy, urology, enteral nutrition, and wound care. Shield has actually been in business over 60 years, and we warehouse here locally in Aurora. We're out near the airport. And generally, product is to the consumer within 1 to 2 business days. Once we receive an order from a hospital, a physician, whoever it might be, depending on where it's coming from, we will actually ship the order on a verbal from the physician. We will obtain the documentation, but while we're obtaining the documentation, a 30-day supply has already been sent to the consumer. If you can go to the next slide, please. One of the things that we're most proud of at Shield is our educational platform. And you can see here, this is from our website, and you can look at any particular category that we service, and you can click on that, and you will see hundreds of videos, webinars, articles on any particular topic that you're looking for. And with that, I'm going to pass it on to Cassandra, because she's going to talk a little bit more about that education, because she has a large role in that education piece. And Cassandra is our registered dietitian here locally.
You know, I'm not sure that we got Cassandra promoted to a panelist. Oh.
Sorry, we paused the video. My name is Cassandra, and I'm the registered dietitian with Shield Healthcare. So my primary responsibility is to do bedside teaches, go over the tube feeding equipment involved, and then also provide follow-up nutrition assessments. I think it's really important that we stay home and stay healthy, especially during these unprecedented times. So I'm able to actually meet virtually with the patients on service with us. So if individuals are wanting more education on overall healthy eating habits, or they're looking for nutrition or tube feeding guidance, I'm more than happy to help. Also, you know, FaceTime has been really handy. You know, so if there are complications that occur, FaceTiming or texting would be an appropriate way to communicate with me. Just kind of adds an additional personal touch with Shield Healthcare. So that's pretty much sums our highlights our nutrition program. So thank you so much again for putting this together and allowing us this opportunity to share our services with you.
Great, thanks so much, Carlene and Cassandra. That was great. And then next we have Team Select. So we have Liz here.
Hi.
Hello.
Thank you so much for having us and
thanks
for putting this together.
Absolutely.
So I'm Liz, and we are Team Select Home Care, And pretty much what we do is family CNA. So we pay family members to care for their loved one with a disability. And the program is no cost to the family whatsoever. And Kayla, you can go ahead and go to the next slide, please. Perfect. So our family CNA program is based off 3 qualifiers. The first is a Medicaid benefit. And if you don't have Medicaid, I can absolutely help you out with getting that benefit. The second is a long-term disability. So we work with a lot of autism, Down syndrome, CP, and many more. And the third is they require hands-on assistance with activities of daily living. So pretty much we're paying our caregivers for things like bathing, dressing, grooming, preparing meals, most of the things that they're already doing every day. And you can go ahead and go to the next slide. So another thing I wanted to mention is that we support all ages and all types of disabilities. We have a lot of adult children that care for their elderly parents. We see husband-wife CNA, and it's also not limited to family for that matter. So we've had situations where the nanny could become the CNA because both parents work full-time. It could be a friend, a neighbor, whatever the situation might be. As long as there's somebody willing to go to the CNA school, which we're paying for, and the patient meets those 3 criteria. So at Team Select, we do specialize in this one program. And with that, we tend to expedite the process and do it with a lot of TLC. The families are very supported on all ends throughout the entire process. We have a family navigator whose sole job is to hold their hand from the time we go to the home and do the evaluation all the way through school and up to the start of care. And once we start care with the family and they're getting compensated for the tasks they're doing in the home, they get a relationship manager here in the office who's going to be their point of contact for scheduling, payroll, anything related to that. And then I'm always available as a resource as well. As I said, we are very family focused and we'll assist with anything when it comes to navigating community resources, if they need help exploring different Medicaid waivers, therapies, respite. I'm always happy to help our families with that. And even if you're not a Team Select family and aren't interested in becoming a CNA, feel free to use us as a resource. I'm always happy to help with whatever it is that you're needing assistance in. And you can go ahead and go to the next one, Kayla. So referral process, we keep it super simple. If you're interested or know of somebody that you feel would benefit from becoming a paid caregiver for their loved one, all I would need is a first name and phone number. Feel free to reach out to me at any time. Phone's always on, I'm always available, and I'm happy to help in whatever way I can. And huge thank you to Developmental Pathways for setting this up. We got to get creative during this virtual time. So thank you, and that's all I have. Let me know if you have any questions at all.
Thank you so much, Liz, with Team Select. So that concludes the presentation portion of the session, and we'll open the Q&A. So if you haven't had a chance yet to ask a question of any of these presenters, go ahead and drop that in the chat. And all the presenters can go ahead and turn on their video and chat. And if you want to see any of these presentations, any of this material, there is also a link that we'll drop in the chat that you can access. This will have all of the slides, all of the contact information for everyone here, and you can reach out directly if you have any questions, related specifically to your family and your loved ones. So just go ahead and check out that link. And also, I want to take a moment right now before we do the Q&A to thank every presenter that's here, and also a special thanks to the presenters that donated prizes for any of our attendees. There will be a link in the chat where attendees can go ahead and sign up for entry into our drawing for prizes. So for every session you attend today, you will be entered into our prize drawing, and we'll let people know next week if they've won a prize. So, so Allie, do you want to go ahead and lead us through the Q&A if there are any questions here for our presenters?
Yeah, so I have two questions that we were, I guess others that were wanting to be answered. I know some of you have already answered one of the two questions, but if we could go through each provider and have them answer them both. The first question is, during the times of COVID, what special precautions are you taking in dealing with people face to face? And then the other one is, do you have any Spanish speaking resources or assistance available? So we'll go ahead and just start, and I'll kind of do the lineup so each person can answer. MGA Home Care, do you want to go ahead and start? Okay.
All right. I'm sorry. There we go. Okay. So as far as COVID precautions go, we kind of play that on a case-by-case basis with our families and our clinicians. I have some clinicians that have some predispositions to COVID, and so they are seeing kids strictly via telemedicine right now. It kind of depends. I know like Johnny mentioned, we do have a private duty nursing division, so we do have a wealth of kids on trachs and vents and G-tubes that are pretty medically fragile. So in those cases, we will try to do telemedicine if it's appropriate, and if kids can obviously kind of stay engaged in some of those therapies. If not, we also have the options of making sure our clinicians are donning PPE and or performing visits outside if it comes to that as well. So there's a couple different options we can go. It just kind of depends on the particular situation of the family as well as the clinical staff. As far as Spanish speaking goes too, we do have some Spanish speaking staff. That's pretty limited. Ultimately, we just kind of rely on the kids care team. So that's aunts, uncles, cousins, neighbors, even if there's any bilingual kind of persons that are close to kiddo that can kind of be available for translations. I'm sorry. Our clinicians also have access to a language line that we can utilize in case there isn't any of those available bodies that can kind of translate for kiddo over the course of the treatments as well.
Great, thank you, Shilton. And then Pasco?
Hi, thank you. So most of our caregivers that have been with Pasco for many years, they live in the home with their clients or their loved ones. And so we minimize the risk of COVID there. For the caregivers that are coming on board over the last 6 to 8 months, what we do is we do most of the intake virtually. And then if we need to be in person, obviously our CNAs that are out in the community providing care are using all the PPE measures. So that's that, but everything we do, we try to do it virtually when and if possible. We have the technology to be able to do that. In terms of bilingual staff, from our intake through onboarding, we have bilingual staff that helps families primarily in Spanish. And again, if there are any other languages, then we get the right resources in place to be able to help and support those families.
Okay, thank you so much. And then Deb with Reset Fitness.
Yes, so I touched a little bit about that when I gave my presentation. We're a boutique gym. It's by appointment only. There's never more than 10 people in the gym at one time. We have very strict rules that we follow in terms of people have to wash their hands before they enter the gym. The equipment's clean before the clients start and after the clients are done. So we do double take on the cleaning side of things. All the personal trainers wear masks. I am going to start instilling that my clients wear masks as well, especially when we are in close contact with each other, just as an added precaution. But in the past, I have not followed that rule. And I will also be offering virtual classes. So for people that don't feel comfortable going in the gym, even in this environment, I'll be glad to offer virtual classes so you can still get some exercise while doing it safely in your own home. And then as far as Spanish speaking goes, I don't speak Spanish. I'm the only trainer for Reset Fitness. So, but I welcome parents or siblings or others to come along and sit in the gym and help with the communication. So anyway, so those are my answers. And if you have any more questions, just feel free to reach out. Thank you.
Great, thanks, Deb. And then Shield Healthcare. Hi, yes, at Shield Healthcare, we really try to minimize our in-person interaction. Typically the only time I'm having that face-to-face interaction is in the hospital, and that's if family prefers that method of teaching. I'm also open to doing virtual as well. But sometimes when you're transitioning into a home environment, leaving a hospital environment, it's nice to have that in-person connection. In regards to Spanish services, we do have a customer service representative that speaks Spanish and is able to translate. And then we also have an interpretation line to accommodate other languages as well. Great, thank you so much. And last, Team Select.
Yeah. So in terms of COVID precautions, we are not sending any CNAs to in-person schools. School is done fully online and it's self-paced. In terms of the initial assessment, that is still being done in person. However, if we have families that are sensitive to it, we've had situations where it's done outside, maybe in the lawn or on the driveway. Our nurses are really diligent with using their PPE, and it's kind of done on a case-by-case basis, but we've been very diligent all around. In terms of Spanish-speaking resources, we do have community reps like myself that are fluent in Spanish, as well as nurse case managers and office staff. So we're covered there. Caregivers do have the option to take CNA school in Spanish and take the written portion of the exam in Spanish. The only thing they need to do English in is just the hands-on skilled portion. But we do have translation services available as well, and we can absolutely support that population.
Great, thank you so much. And I believe that wraps up all the questions that I had on my end, and then I'll turn it over to Marilyn.
Thank you so much, Allie, and all of the presenters. So that concludes our session, and we will go ahead and have another session starting at 1 o'clock. So presenters, you're welcome to join back in for that if you'd like. You're welcome to drop off now, and just know that we'll have your information on our landing page, and families will be able to access everything there. So thank you so much, everyone, for being here, and recreation is our next group that starts at 1 o'clock. So we'll see you all then.
Thank you.
Take care.